All right, so today we are starting a new chapter. It is covering the foot and ankle. And I know these images right here might be a little bit graphic for you, but again, you did sign a consent form last year, or at least if you had me the year before. So yeah, hopefully this isn't something that's too gory for you. If you look at this image, you can see that this is definitely a fracture. The bones that are most likely broken are going to be your tibia and your fibula. But as for other injuries, not sure you can see, it's definitely where the bone is sticking out. Might be some soft tissue damage. You do not need to write down these slides right here. The next slides you will have to write down the notes from, but just by the end of this, you guys will hopefully be able to know the bones of the foot and ankle, the ligaments that pertain to the foot and ankle, those muscles as well, the tendons, and then blood vessels, nerves. So just basically a lot of the anatomy we're going to focus on for the next couple days. And so hopefully after this, you can start to remember them, understand them, and so forth, because you will need to understand the anatomy in order to get to the actual assessment portion. All right, so again, another graphic image. This looks broken. Not sure if anybody watched the NFL game on Sunday, but the Cowboys quarterback Dak Prescott completely broke his leg, his lower leg, and it looked kind of similar to this. But anyways, obviously a possibility in sports. So your foot contains 28 bones. 16 of those bones are coming just from your phalanges. So we kind of went over this when we went over the skeletal system, but just know that you have little portions of your toe, and those are phalanx. They all add up to the 16 different phalanges. So you have your proximal phalanx, which is right here, and then you have your distal one, and that's your big toe or great toe. Remember, proximal means closer to the body, and then distal is further away. When we get to toes 2 through 5, that's where you actually have 3 phalanx that make up the toe. So you'll have your proximal phalanx, which is referring to this one. These ones have an intermediate phalanx, and then they also have a distal one. And then you do also have a sesamoid bone. So a sesamoid bone is essentially a bone that is just connected to tendons. It's not connected to bone like other bones are. Your kneecap, your patella is actually a sesamoid bone. So we have one in our foot too, and it just sits right here, kind of at the base of your great toe. All right, so again, foot contains 28 bones. So you have 16 that are making up your toes. You then have 5 that make up your metatarsal. So that's kind of the top part of your foot. You then have tarsal bones. So these are just small bones that kind of sit either below your ankle or they sit a little bit in front of them. So you have 7 of those. You have your cuneiforms. And so this image kind of shows where they are. You have your medial one, which is obviously on the medial side of the foot. So it's lining up with your great toe, or I guess toe number 1. And then you have your intermediate cuneiform, and then your lateral cuneiform. And then just more lateral to that is going to be your cuboid bone. And you guys are expected to start memorizing this stuff because you will, like I said, need to understand it down the road. Then you have your navicular, which is just behind that. And so that's on the medial side. And then you have your talus, which sits on top of your calcaneus. So just a reminder, your calcaneus is the anatomical way of saying your heel. You have a bone that sits on top of that. That's your talus. And then what connects to that is going to be your tibia, and then you'll have your fibula off to the side. And then that kind of just goes into this. So your tibia and fibula are your lower leg bones. Just remember it is tibia and fibula, not fibia and tibula. Try not to get those confused. And then just remember too, your tibia is what we commonly call your shin. Your fibula is just a bone off to the side of that. And if you look at your ankle right now, you might see that you have like 2 pretty bony parts that stick out. Those are the ends of these 2 bones. So on the lateral side, that bony part that sticks out on your ankle is going to be your fibula. And then on the inside, that bony part that sticks out at your ankle is the tibia. All right, so again, you have 14 total phalanges. And that is just where we're talking about these toes. And then you have the 2 that make up the great toe. And so if you combine that all, you have 4 toes times 3, then that's going to be 14. I think there might be a discrepancy, I guess, with the last one. So it should be, yeah, 14 total, not 16 total. So disregard that first slide that talked about 16. I think that one was probably including the sesamoid bone, but just know with the phalanges, you obviously only have 5 toes. The first toe is only going to have 2 parts, and then second through 5 are going to have 3 parts. So if you add that all up, it makes 14. And then again, just remember each toe has a proximal phalanx, intermediate phalanx, and a distal phalanx. However, the great toe only has a proximal and a distal. And then again, I think that's where the 2 numbers came up. So yeah, your great toe has 2 sesamoid bones. Like I mentioned, they're like your mini patella. So the purpose of it is just basically to increase more leverage in that joint, and then also to protect the joint as well. So it sits at the bottom of your great toe, and that's kind of where you put a lot of weight when you're walking. And so it can kind of help protect it and also allow you for better movement. Like I mentioned too, each of your toes has a corresponding metatarsal. So just start remembering to call them by numbers. So you have your first metatarsal, which is your great toe. You have your second, which is next to it, third, fourth, and then fifth would be what we'd probably think of as lining up with your pinky toe. So again, I'm going to try to not use pinky anymore, and I probably won't use maybe big toe. I'll probably use great toe, or I might say phalanx 1 or metatarsal 1. And then, like I mentioned, you have 7 tarsal bones. So this gives you basically a map of where they're supposed to go. So again, you have your cuneiforms. You have 3 of them, and they're titled kind of where they're located. So the medial one's obviously going to be on the medial side. The intermediate one's going to be, more in the middle. And then you have your lateral one, which is obviously more lateral. But you also have your cuboid bone that kind of lines up with it too. That's going to be the most lateral of those, I guess, 4 bones. And then you have your navicular, which, like I mentioned, is on the medial side. It's sitting kind of closer to your ankle, so behind your medial cuneiform. And then you have your calcaneus, which is your heel bone. And then what sits on top of that is going to be your talus. And then, like I mentioned too, that's going to connect your tibia with your fibula. Okay, so tibia and fibula extend past your talus. That's kind of what I was talking about. So if we go back to the bony parts that you might feel on your ankle, the one that is on the lateral side, so the outside, that is actually a part of your fibula, and it is called your lateral malleolus. So you need to remember this. Lateral malleolus is a term I will use several times, but just remember when it comes to bone names, you have the names of the bones, and then you have different parts of that bone that have different names. So I kind of refer to them as bony landmarks. So one of the bony landmarks of your fibula is going to be that bony part that sticks out called your lateral malleolus. And then your tibia has something similar. So on the inside, that is going to be your medial malleolus. And again, that's that bony part that sticks out. But just know that it is all part of your tibia. This is just a bony landmark. I guess, within it. Your tibia is obviously the larger of the 2 bones. Like I said, it's commonly referred to as your shin, and it is your primary weight-bearing bone. So if you were to injure your tibia or fracture it, oftentimes the physician, maybe an athletic trainer, might actually have you not bear weight on it. So maybe you'd be in crutches or a walking boot, and that's the reason why is just because it bears a lot of weight. Whereas not opposite, but other than that, you have your fibula. So this one is actually smaller, and it actually sticks down further. So again, remember, distal means further away. So your fibula, if we go back to this first picture, sits more lateral, or not laterally, more distally, also laterally. And so it's extending further, and we'll get into the reasons why that matters down the road, but just know that lateral malleolus sticks down further or more distal than the medial malleolus. And then this one is where you have a lot of muscle attachment sites, which we'll get into muscles in the next day. But it also only bears about 10% or less of your body weight. So when you're walking, your tibia is bearing the majority of the weight, and then your fibula is kind of aiding in that. And that's where if you see maybe someone has broken their ankle or maybe their lower leg and they're in a walking cast, or maybe they're in a walking boot and they broke their leg, it's probably because they only broke their fibula. And that's just because they're able to put a little weight on it since it doesn't really bear that much weight. Whereas, like I said, if you were to fracture your tibia, you're going to be non-weight bearing because it does bear so much of your body weight. Last thing we'll talk about are the ligaments. So this is probably one of the more complicated parts of memorizing these different anatomical terms, but just try your best to remember them. The first ligament we're going to talk about is your calcaneonavicular ligament. Ligaments are often named after what bones they connect to. So the calcaneonavicular ligament is named after where it's connecting. So it's going to connect the calcaneus to your navicular bone. So it sits right here. And it's also commonly called your spring ligament. So you can actually sprain this ligament. It can cause issues with walking, things like that. So again, just try to remember these names. On the medial side, you have what is called your deltoid ligament. So the deltoid ligament is actually 4 ligaments, which is why it's named deltoid. You are not expected to memorize every single ligament name for this one just because there's so many. When I was in school, I had to remember this, but I'm not going to make you guys have to do that. So just know on the medial side, these are the deltoid ligaments. And then on the lateral ankle, you have 3 major ligaments that you are expected to know. And the reason why is just lateral ankle sprains are the most common type of ankle sprain. And we're going to get into assessment, evaluation, things like that. And you will need to know kind of what the different ligaments are and, you know, what could potentially be damaged if you were to sprain your ankle. So the first one is going to be your anterior talofibular ligament. So it's named anterior, obviously, because it's in the front. And then it's connecting your talus and your fibula. So it sits right here. Fibula is right here. Talus is right here. Next one is going to be your calcaneofibular ligament. This one sits just kind of directly below your fibula, and it connects calcaneus and fibula. And then you have your posterior talofibular ligament. It's not shown in this image, but again, posterior means behind, and then it's also connecting your talus and your fibula. So it's going to be more over here. You can't really see it because it's being blocked by this fibula, but just know that that is also a ligament that you can sprain. And ATFL and the CFL. So I call them ATFL and CFL because it's anterior talofibular ligament. And then the CFL would be the calcaneofibular ligament. But just know these two are the most common ligaments that you can sprain. And it's definitely probably one of the most common in sports. And then last thing I believe I'm going to talk about. So your lower leg also has ligaments. You have this major ligament that runs between your tibia and your fibula. You can actually sprain that as well. And that is what is known as a high ankle sprain. So I know, like, if you maybe follow sports, you might hear so-and-so had a high ankle sprain. Basically what that means is just they tore the ligaments in here, not so much down here. And so for these ones, you have your distal anterior tibiofibular ligament. So same as the other ligaments, they're named after what they connect to. And then you have your distal posterior tibiofibular ligament. And then the interosseous membrane is that ligament, or I guess membrane, that you could potentially sprain in a high ankle sprain. So I wouldn't stress too much about remembering these ones, but just know that these obviously are other parts of the foot that can be damaged as well. All right, so we will stop there. So just make sure you get your notes turned in before the end of the period, and we'll continue on with this tomorrow. And I hope you have a good rest of your day.